This new program coming into effect, you hope in September. Could you tell us what it's all about?
It's called the Community Health Assessment Program by EMS, and it's to do more studies with McMaster University as far as helping the elderly determine what sort of risks they have and keeping them from using the emergency department when they don't necessarily need to, and getting them more supports in where they are living right now. And we see paramedics as highly trained in being able to do that type of thing.
So where will you be starting the program, and what will the paramedics be doing?
It'll start in Bruce County. We're looking at two facilities. They're in conjunction with the social housing. It's 401 Cayley Street, and the other one is 621 Mary Street in Wyerton. And the paramedics that we'll be using would be ones that are on light duties, so we're not taking vehicles off the road or anything. It's somebody that might be on modified duties because they're pregnant or they have an injury and they're not able to come back onto the road right away.
And a question was asked of you, how is the staff reacting to this? Have they been informed of such a program?
Many of them are aware of the different programs going on. We are looking at this as, when we do have them on modified duties, we often have trouble finding appropriate duties for them to get them back to work sooner, and this will keep them doing skills that they're trained in and keeping their skills up. So,
do you see something like this becoming more of a role for paramedics, perhaps an evolving role?
In some areas it has. Grey County has already started a program having medics off the road and staffing them that way, that they are dedicated community paramedics. Each area has to look at their own funding and abilities to do that type of thing, and eventually things may go that way. There are a lot of studies going on right now, and that's one of the reasons we're doing this with McMaster, because it is work that's getting looked at to see how beneficial it is and what role there could be in the future for paramedics in this type of field.
What kind of information are we going to be getting from the seniors?
We'll be looking at taking their blood pressure, doing some other vital signs. If they're a diabetic patient, maybe checking their blood sugar levels, going over stroke risks, heart attack risks, medication type of things, and any sort of materials that they're interested in learning about, and any ways we can help reduce their risks, as well as informing them with the appropriate uses of what 911 is and appropriate times to go to emerge versus calling their family doctor.
Okay, thanks very much.
Good.